Try again. Says live. Should be working. I'm not sure what the problem is, but I mean, I want to hear from you guys. So if I can't hear from you, it's no fun. So something's weird. How odd. We'll try again. Sorry about that. I don't know what the problem is with YouTube, but I definitely want to hear from you guys. So if you want to talk, let's talk. Looks like it's working from my side. I'll put a howdy. There we go. Hey, Debs. I don't know what was going on there. Excuse me. Really was weird because everything looked correct, but it wasn't allowing any messages come through from anybody. Hey, Robin. Okay, so where was I? Just wanted to say, first of all, ending my Monday fast. That's gone very well, and I feel fantastic. Very clear-headed, mind and all, and it all seems to be working right. And I don't feel hungry, and I'm sipping on some water tonight. So it's about 8:15. So I thought I'd jump on and you guys, for some reason I couldn't see you, and I wanted to see what you guys had to say, because that's the fun in it for me, is to talk to you and hear from all you guys. Hey, Kathy, Debs, Robin. But it just nothing was populating. So I saw 11, we're here. And then of course we just ran a bunch of people off. So, well, I hope they'll come back. But anyway, so I hope you're having a good day today. And if you're fasting, I hope it's gone well for you as it has for me. Had an interesting day in the clinic. We had Banana Mania, and that was an awesome opportunity to let somebody come in and who's not a part of our group, who was able to share their story about how they have gone whole food, plant-based, and beat diabetes, and that's fantastic. So warm and rainy, just warm here. Not really raining, but it was very humid today, so I expected that it might rain, but it didn't. So have to check the weather report as we get closer to the weekend to see how that's going to go. But we had Banana Mania come in, and he told us his incredible story, and it turned out that we actually they have children at my daughter's school, and Mrs. Banana Mania knows the DW. And so I was just talking to the DW. They actually have had chatted several times. So that was really interesting to know that they had been through all of that. They're not members at our church, so we weren't really aware of his situation and what he'd been through. It was just interesting, though, that they share the same school as my daughter Abby goes to. So Abby's not looking forward to going back to school, so she says. Tomorrow's her first day back, and I think she's ready to go back. I really do. I think she's ready for this vacation time to be over and get back to a regular routine. I think she is, even though she doesn't want to admit it. Then we had another patient came in. He was Tango Mango was the name that he got, and he had a cyst on the back of the right shoulder. So we took care of that at the last part of the clinic. He was actually scheduled for 3:45, but we were running behind schedule with lots of new patients and lots of acute injuries and things like that came in toward the end of the day. So we got a little bit behind schedule, and so we started about 4:15. Usually we're wrapping things up by then. So but he had a cyst, and it turned out, hey, Chrissy, it turned out that Mango Tango is the son-in-law of Shark Baby Seal, which we got to talking, and he said, yeah, Shark Baby Seal is my mother-in-law. And so I said, no kidding. I mean, that was really fascinating. So he's a legacy patient, and so we got to talk a little bit about that, and it was really, really an interesting story. So for those of you, yeah, small world, right? He said, so I had to give a shout out to Shark Baby Seal. Well, And so, yeah, Chrissy, you came. I come up with the most strange names, yes, but there is a pattern. There is a pattern for these nicknames, and if you can tell me what the pattern is over the last couple of weeks of yeah, legacy, that's good. Hey, Joe. If you can tell me what the pattern is for these names, I will send you a free bottle of our new Cocoa Skin Plus. So, first one to tell me what the pattern is, I will. Yep, you're jinxed, Joe. You just got jinxed. Hey, Violet. If you can tell me what the pattern is, I'd be happy to send you a free bottle of our new Cocoa Skin Plus, and I'm happy to do it. So tell me what the pattern is. If you've been watching the videos that have come out, and you've noticed that there's some strange names, if you can tell me what those names all have in common, I will send you a bottle of Cocoa Skin Plus, our new and improved version of Cocoa Skin Plus. No, it has nothing to do with being vegan, although that's neat. Nope, nothing to do with fruits. We had a patient whose name was, you know what? I'm not going to tell you. You're going to be watching the videos. So some of these videos, there's a processing period that occurs. So I make the video. The video gets uploaded for my editors. They download it, they take it, and they work it into the schedule. And so sometimes it may take, it may be a couple of weeks after I do a video before it actually shows up live. And sometimes they take some of the older stuff and they mix it up and they do interesting things with it. And so we just let them do what they're doing. But they do a fantastic job, and it prevents me from having to spend hours editing. So you didn't miss anything, Vi. We're just saying hi, talking about ending our Monday fast if you're fasting today. And so I'm sharing that with you, that I'm ending my fast on Monday. And Shark Baby Seal was not my idea for a name. That was her idea. So she wanted her to be sure that if we made a video, she had a granddaughter. She has a granddaughter. She wanted to be sure that if her granddaughter was searching, she'd be able to find her video. And she said her two favorite things to look up on YouTube were sharks and baby seals. So she said, so call me Baby Seal Shark or Shark Baby Seal. So I said, fine, you're going to be Shark Baby Seal. And that's how she got her name. Thank you, Vi. I noticed as I made the video today, after we were finished and I got back home and transferred the video off of the camera onto my Mac, I looked at the video. I watched the video, actually watched most of it. But anyway, I noticed that there's very little noticeable shaking or tremor in my hands for this procedure, and that really made me happy. Let's see. My supermarket has this message on their website. Please note, due to a shortage in supply, you may not see bananas. Yeah, Joe. I think you ate them all, Joe. Oh, that's pretty sad. I'm not seeing anything like that here. Is it just down in your area, Joe? I wonder why you're having trouble getting bananas. We're not having any banana shortage that I've noticed. You jinxed it. That is kind of funny. So if anybody, the first person on this site, if you notice a link, if you figure it out, you let me know, and I will send you a bottle of Cocoa Skin Plus. And I would love to do that for you. Even if I have to send it to New Zealand, you will get it. How's that, Joe? How's that for incentive, right? Nope, not exotic fruits. Nope. We had one, I should tell you his name. I'll tell you, it's going to give it away. So we had Mango Tango today. We had Banana Mania today. And I think the last one that I remember we did, his name was Brick Red. And let's see, I can pull him up a couple of more here. Yeah, yes, Cocoa Skin Plus is my invention. We had, let's see, we started really doing this recently, right after Aggie Drew, and I think Aggie Drew has made it onto the main page. Let's see, and I'm clicking here. Yep, I'm pretty sure that was Brick Red was his name. So they sound like album covers and flavors and things like that. They do. Okay, so yeah, Cocoa Skin Plus is my invention, my development. I took some basic ingredients and made some changes and a little addition, and we found that we had Cocoa Skin Plus out for a while, and the Plus was one of the oils that's added to the capsule, and we left the oils alone, and we changed the biotin, and we're really getting some good results back from patients. A lot of good feedback, and it takes time for this to once you come out with a product like that, and you give it to people, and you give them a 90-day supply, that kind of thing. Then it gives them an opportunity to come back to you and say, hey, this is how it's working for me, and that kind of thing. Nope, not fishing related, Joe. Good guess, though. And Novi, not things found in Texas, although they may all be found in Texas. That's not what it's about. I did hear recently on the radio, was pretty interesting about Texas. They said that we have the greatest, this is the best place to eat in the United States, is in Texas. Apparently we have the largest variety of foods in the United States in Texas. Apparently our unique mix of ethnic populations of peoples from all over the world give us a lot of choices. We have a very large Vietnamese population, for example, in Houston. Houston being such an international city, where we have people coming in from literally all over the world due to the oil industry and the energy industry. It's not unusual that we have peoples from all over the world that have individual communities and restaurants and things like that. Oh, Chrissy got it. You got it, Chrissy. Yes, they are colors in the Crayola Crayon 64 count box. That's where the names are coming from. All right, Chris, send me an email and with your address, and I will send you out a bottle of Cocoa Skin Plus for playing my game tonight. There are only 6 people here to play, but it was still fun. Yeah, that's where the names are coming from. They're coming from the 64 count box of Crayola crayons, which was fun for me to look for an interesting place to find new names, because what's happening is we're just getting a lot of repeat names, and sometimes that confuses people. Colors like, remember Ms. Blue? So I think she was the first one, Ms. Blue, and then we had a repeat magenta name, and then we went into some of the reds and so on and so forth. And Robin was checking the military codes. Funny, Debs, we were talking today in the clinic, we were talking about Young Frankenstein, the movie Young Frankenstein. And so your daughter gets the credit, Chrissy. That's awesome. And what a great movie that was. We were talking about Gene Wilder. That name had come up, and talking about who Gene Wilder was married to, and it was Gilda Radner. And of course, she passed from breast cancer. And that was the discussion, because we couldn't remember something having to do with Gene Wilder, and we were coming up with different names, and then we were coming up with all the names of the actors and actresses in the movie Young Frankenstein. And we were trying to do this from memory, and I could not remember Peter Boyle, and he's one of my favorites because he plays the monster, of course, in Young Frankenstein, and he does such an outstanding job in that movie. I just love his acting in that movie. And so Anyway, so you said, and I couldn't remember, and then I saw, I remembered Susan Boyle, then I remembered Peter Boyle. So Susan Boyle was amazing, and there are a lot of there are probably thousands of undiscovered people with amazing voices out there, that that are just probably will spend their whole lives with these beautiful golden voices and not be discovered. Kind of like Ohio. Madeline Kahn. Teri Garr was the other one that nobody could remember. I remember Teri Garr was one of her first, I think one of her earliest movies or early in her career. And Madeline Kahn was outstanding. But just had a lot of fun. We were talking about it, and Cloris Leachman, one of my favorites. She was fabulous in that movie. And actually afterward, I had a few minutes and I was actually watching some of the blooper reel. There's some bloopers from Young Frankenstein on YouTube that you can watch. It just goes to show what a great group of people they were, and they did a lot of movies together. But if memory serves me right, I don't think they spent a lot of time making that movie. Most of it just sort of flowed naturally for them because they had such great chemistry together. And it's fun to watch. I've watched it a number of times, and it used to be a favorite of my late wife. She loved Young Frankenstein. So anyway, we watched it a lot. So, and we got talking about it today. And it was a lot of fun talking with Jilly Gumdrops, the nurse practitioner, Jill, and actually we had a couple of patients chatting with us about it in the hallway. I guess that's why we couldn't get done on. We couldn't get done on time if we're so busy chatting in the halls with everybody. So it was a fun day. It was really a fun day, and it was a great day to be a doctor today. I will tell you that. And I enjoyed my patients today, and we had some challenging injuries that came in. We had a patient with chest pain who came in, had patients with shortness of breath. So the afternoon was challenging because there were a lot of variety of patients that came in. And I've actually thought about just writing down, just keeping a list of the different kinds of cases because I thought it'd be fun maybe to talk about those. Yeah, everybody's fine. Everybody's fine. No problems. Nothing we couldn't take care of. Thank you, Vi. Thanks for your concern. That's what we're there for. We're there to help people who come in with problems or with issues and those kinds of things. And so that's what we do, right? We take care of injuries of all kinds. We have our X-ray facility, and we have EKGs, and we have pulse oximetry, and we have pulmonary function tests, and we're able to determine rather quickly whether somebody is really ill or if they have a treatable issue. Not to say really ill, but sick enough to be in the hospital, I should say. And so that's what we do, and we take care of them, and we get them fixed up. And if we're able to treat them and get them on their way, that's what we do with a follow-up. And if we're not able to treat them in the confines of our clinic, or if we're not able to make a definite diagnosis, then we send them over to the emergency department with a phone call, and we tell them what's going on and what we think's going on and what they need. And the local ER, when we call, they answer because they know if we're sending somebody over, they're sick. They're not just somebody coming in with a minor problem that we're not able to take care of. They know they're sick because we do a pretty good job, I think, in our clinic of keeping our patients out of the emergency rooms and keeping them out of the hospitals. Yeah, that's what we try to do. So it was an interesting day. It was a busy day, and we did get a cyst, and that was fun. It's always fun for me if I get to remove a cyst, and so we did that. And like I said, it was gratifying watching the video later and seeing that from a standpoint of the tremors, anyway, that I've dealt with, that seems to be really improved. It's noticeably improved to where I feel a lot more comfortable making the videos because for a while there, I was really uncomfortable with it. I had a patient in today with Sjogren's, Joe. It's not as uncommon as it used to be. Sjogren's, I had a patient in today. In fact, the patient that I had in today that was having chest pain was a patient who was a Sjogren's patient. In fact, it was a gentleman, a young man with Sjogren's, and that's very unusual. Most Sjogren's patients are ladies. epidemiology of Sjogren's is about 85% female to 15% male, much more common in women than men. And so this patient was having chest pain, and we ruled out immediately that his chest pain was heart related. Although he did fit into the age bracket where, that was not impossible, but we ruled that out quickly. And then we were able to determine that his chest pain most likely was an esophageal spasm, which was related, I believe, to his Sjogren's. So I ordered an upper GI series so we could get a good look at the motility of his esophagus and the patency of the lower esophageal sphincter, and the ability of his stomach to still move, because a lot of times with Sjogren's syndrome, we see a lot of digestive issues, especially in the upper GI system at first. So, so we ordered upper GI so we could get a look at that. And if we do have some motility issues that are leading to chest pain, we can deal with that, but we need to be sure that that's what it is. And we felt very confident about our diagnosis. So, let's see. Anyway, read some studies about hereditary research. Do I think it can be? I think that the propensity that there is a genetic link to some autoimmune diseases. I think that diet plays a bigger role right now, and I think that the fact that we're seeing a lot more autoimmune problems is related more to our diet than it is to heredity. But there can be a hereditary propensity. Like some people are more likely to develop diabetes because they have strong family histories of diabetes, but that doesn't necessarily mean they will absolutely get diabetes. It means that they're more likely to. Let's see. Watching one of my videos, and I said their visit was free because they allowed you to film. I thought that was really nice of you. So I'm actually working on a list of some of the ethics that are involved with videoing patients. And, we've run into some red tape and some issues. And, the more of this that you do, the more people become aware that it's happening. And I think that there are some ethical issues, and one of the issues that I'm really bothered by, and I'm gonna mention it here because I trust you guys, and I know that that I try to be thoughtful about these things. One of which is exchanging a procedure and requiring the patient to allow themselves to be identified. In other words, requiring the patient to give up their identity as part of doing free medical care in exchange for it being videoed. Let me clarify. I have patients that come in that as part of their routine visit, they want to talk. They want to share their story, and I allow them to do that. If they do that, and that's something that they want to do on their own, I let them do it, but I don't own the clinic in which I work. And so I don't have the ability always to say, oh, well, since you want to talk about your story, you want to tell your story, I'm not going to charge you for this visit. We're not going to bill your insurance for your visit. That's not fair. That's not fair to the owners of the clinic. Now, what I do sometimes is I'll say, okay, for example, I got a couple of emails from a gentleman in Austin who has a pilar cyst on his scalp, and he wants me to remove it. And I said, okay, before you make the trip down from Austin, let's talk about what you've got going on here. Send me some pictures. So he sent me some pictures, and it very strongly looks like he's got a pilar cyst, and certainly well within the realm of something we can take care of in the clinic. And he asked me about, he said, now is it free? And I said, well, here's how this works. If you come to my clinic and I do the procedure and we videotape the procedure specifically, we have you come in and you come in specifically to do it, and you want me to do it free in exchange for us videoing for YouTube, I'm perfectly okay with that. I don't have any problem with that at all. I'll do it free. My services will be free. However, your clinic visit, the time that you take in the clinic, you still have to pay for. So they still have to pay for a regular office visit, which is usually covered by insurance, that kind of thing. So what I'll do is I'll say, I'll waive your copay. We'll still bill your insurance for the standard, whatever level 1 or 2 or 2 or 3 office visit, but I'm giving you my services free. So the procedure will be free. So there's a little tightrope I walk there so that the owner of the clinic doesn't feel like he's getting shortchanged because I'm making videos. Okay. So that's how I handled that. Now, if somebody comes back to me and says, okay, I really can't afford anything, but I want you to do it, and I don't mind if you video it. In those cases, I will pay for the office visit. Now, I pay for that. Okay, so that's out of my pocket. So I pay for that office visit. So that's how I take care of those. But I think it's unethical to require somebody to show their face, show their identity in exchange for doing a YouTube video. I don't think that's ethically right. I think that's a violation, in my opinion, of HIPAA rules. And I think that physicians that are doing that are walking, they're on the precipice of being in violation of HIPAA guidelines, and that's Health Insurance Privacy and Portability Act in the United States. So I think it's a very fine line. So you have to be very careful, I think. So if I have a patient that comes in and I say, hey, this is a really great case. Would you mind if I video this? And they say, yeah, sure, no problem. Then it's business as usual. If they specifically come in and they say, I want to do this, I don't want my identity shown, but you can video it, then I'll do that. But I will never require anybody to divulge their identity in exchange for a video. I think that's ethically wrong. I have a problem with that. I know it's being done out there, and I will not do that. Okay. I'll just say, look, I'll just do the procedure for you, and I won't video it if that's the case. Okay. I would rather just do it for free than to risk crossing that line. Okay. That's not worth it to me. As much as I enjoy videoing and sharing these cases, I get the enjoyment of doing the procedure, whether it's videoed or not. Remember that. So I still get the enjoyment of the procedure because I like doing things. So, there's a lot of this, and I've heard some people say, if somebody comes into a clinic and you video something, they should never pay anything. I have a problem with that attitude because I don't think that's necessarily fair in a lot of cases to providers and to clinics. I do understand what they're saying. I think that there are a lot of situations where we would do a procedure complimentary. I do a lot of free care anyway, so I don't have a problem with that. But I think requiring it is an issue, and I think that there are some people out there that there are some providers out there that do make that a requirement, and I have a problem with that. So anyway, I throw that out there. But generally speaking, if a patient comes into my clinic and you see a video of me doing a procedure for them, I do not charge them. That doesn't mean they don't pay something, but that doesn't mean that they pay me. And I hope you can make that distinction because I am an employee at the clinic in which I work. I don't own the clinic. I used to own my own clinic years ago, and I did for 8 years in Tomball, Texas. And right after the Affordable Care Act was passed, there was a big movement between hospitals and clinics to join forces in what they called physician hospital organization. So basically what was happening was hospitals were buying the clinics and forming a network. And this was supposed to allow for better care and better negotiating for reasonable payment for services, things like that. And it's a very complex system, and it's something that's very unique, I think, to the American style of healthcare delivery. Anyway, I did join with the Tomball Hospital system. And you guys know Tomball Hospital is where Sue Verhoeven had her procedure done, okay? So this is what happened. 4 months after I joined, my hospital system, which was a community hospital, it was a local hospital, and it was not part of a larger hospital system, was actually bought by a very large healthcare conglomerate. And when they bought the hospital, they bought me. They bought my clinic too. And I was able to work with them for the first year without any problems. But then they came in and they required that we change some things about how we practice medicine. And I had strong disagreements with that. So no need to go into the specifics, but it changed the character of my clinic to the point where it was not an enjoyable thing for me anymore. Okay. So I gave them my notice and I resigned. And I left my clinic. I left the clinic that I started and built and just went to work almost immediately for another clinic nearby. And as a result, I am an employee and I am very happy in my position. My earnings are fair, and I do get a bonus based on my production and things like that. And I'm very happy not to have to deal with a lot of the issues that you have to deal with when you're a business owner. And being a medical business owner is no different. So I don't have to deal with payroll taxes and sick leave and maternity leave and all those things that are important for any business of any kind. It's just, I don't have to deal with them anymore. We still deal with all of those things as a clinic, and they're important things. We have to treat our employees fairly, and if the employees in my clinic were not being treated fairly, I would certainly speak up, and I have spoken up in the past about some issues and gotten them taken care of. So, Tomball Hospital has since been bought again by another group. But what was interesting about it is the individuals who I was working with the first group that came in, many of them stayed on with the second group. So when I picked up the phone and called, I had name recognition with them. They knew who I was. They also know that I still send them patients. So I had a little clout with them, and I was able to pull some strings for Sue. And so that's not what this is all about, but just to understand my situation in my clinic that I'm in now and where I am now and how I got there. And I've been there now. This is, I'm in my 6th year with this particular clinic, and I'm very happy with it. So anyway, let me read up here. Let's see. No, Chrissy, you didn't stir up a big pot. No. It's a good, it's a really, it's a good story, but it's something that's been on my mind lately. And so you helped me kind of remember that I wanted to talk about that, because I think that if you are a podiatrist and you want to video toes and you're not giving up the individual's privacy as far as if you're protecting their identity, and you want to say, hey, if you'll let me video this, I won't charge you. I think that's fantastic. I really think it's fantastic. I do. But if you are upfront telling people, if you want to come in and you want to get something done, you have to be willing to divulge your private personal information, such as your name, okay, and your image in exchange for this. I have a problem with that. That's where I draw the line. I think that's wrong. I think that's unethical. And that is my opinion. There are others out there that disagree with me, and they're entitled to their opinion, and I respect them to have their own opinion. I'm able to disagree with somebody without not liking them, okay? So do a lot of patients expect it, though? Yes. If somebody contacts me initially and says, I want you to do this, but I don't have any money. If I come in and let you video this, will you do it free? My answer is often, sure, I'll do it free, but I don't require them to divulge their identity. I still I still cover them up. I still only focus on the procedure. And I don't require them. And if they say, hey, I want you to show who I am. I want to talk, like Banana Mania did today. He really wanted to talk. He wanted to share his story. I let him. I just turned on the camera and said, okay, if you want to tell your story, this is a great story. I would love it if you told this story, because this is really near and dear to my heart about health and nutrition, and how, we're living in a country full of people that are dealing with heart disease and high blood pressure, cholesterol problems, vascular disease, diabetes, and on and on and on, and all these things that we've talked about. And all of this is almost entirely a result of the decisions we make on a daily basis as to what we eat. Who dat? How you doing? Louise, hi. Oh, thank you, Louise. You're very kind. Let's see. Yes, I think Tomball Hospital did a wonderful job with Sue. But yeah, there are some expectations, Vi, and I try to treat those fairly, like I outlined. I'm much more interested in doing the right thing than I am in making a dollar. So, it's the truth. I mean, at the end of the day, you have to look at yourself in the mirror and you have to say, did I treat people right today? Did I represent who I am at the best that I could? And I think that I think we all do that. I think we all have to do that. And there are a lot of people out there that they're only interested in making money, and these are very unhappy people. And unfortunately, many of them are, and they're doing it to themselves because they're putting, profit before everything else. And I think it's a huge mistake, and it's sad to me to see some of these people. And I know lots of people like that, and they live very unhappy lives. I know very, very wealthy people who are extremely happy, and I know very, very wealthy people who are extremely sad. And it breaks my heart sometimes to see these people that are so sad because their families are broken. They have multiple homes. They have incredible amounts of money, and it's never enough for them. It just doesn't ever seem to be enough. And I think it's sad. Really, I do. But let's move on. Let's see. Oh, good. We have a question. Let me get a sip of water here because I have a frog. I've been reading today. I did some reading about iodine deficiency. And so I've been doing some exploring on that, and I'm going to have some information for you guys down the road about iodine. Okay, Lynn says, is it possible for vascular disease to improve by changing to plant-based diet, or has the damage already been done? Some damage is probably not reversible, but a great deal of that damage is reversible. Dr. Ornish and Dr. Esselstyn, two cardiac doctors. One was a cardiothoracic surgeon, Dr. Esselstyn, and I believe Dr. Ornish was either a cardiologist or a heart surgeon. I'm not sure which. I'm not as familiar with Dr. Ornish, although he is on my list of heroes when it comes to whole food plant-based nutrition and being a physician advocate of same. Both of those individuals have documented, absolutely proven regression of plaque formation in the coronary arteries simply by switching to a whole food plant-based diet. And in some cases, they had them on a low-dose statin, a low-dose medication like simvastatin, lovastatin, atorvastatin, Crestor, Livalo are two of the newer names too. So the answer is you absolutely can reverse that disease, and you may not reverse it to where your coronary arteries or your vascular system is 100% free of disease, but that's not necessary. What you have to have is you have to have good flow of blood through those arteries. And by adopting a whole food plant-based diet, you stop the formation of new plaque, or you dramatically slow it down. And in most cases, you will reverse it. And I'm a big believer that if we as people in Western society would begin to adopt a more whole food lifestyle and plant-based lifestyle, that we would see fewer and fewer people needing our help. Just like Banana Mania, when he came in today, by the time he was done telling the story, and I turned the camera off and I said, well, look, I'm glad to meet you. You don't need me. He said, I guess not. I said, if you have a problem, come back. I said, if you don't, come back when you're 50 and we'll do a routine exam on you and we'll run your levels. But he doesn't need to be in my office. So by him learning to be a whole food plant-based eater, he has eliminated the need to come see me, 2 or 3 times a year for diabetes checks and medications and lipid levels and having to be on multiple medications. He's taking business away from me, right? What's my incentive to tell people to be a whole food plant-based eater? I ask you, it's certainly not money, right? Because every person that converts, I lose a patient. I lose a regular patient. I lose that income from somebody having to come in for new medication prescriptions, for medication monitoring, and all of that stuff. I lose that, right? So if I'm successful in this arena, then I'm less successful in the other arena. But right here where it counts the most, I'm the most successful, and that is really helping people. And that's I would rather all of a sudden everybody became a whole food plant-based eater. We didn't have to keep treating all of these people with diabetes and high blood pressure and heart disease, and their diseases would reverse. They could come off of their medications, and we wouldn't have to do so many medication monitoring and disease monitoring visits. I would be more than happy to see that happen. Let's see. Did he steal the bananas though, Joe? Yeah. Oh, poor Joe can't get any bananas. Seeker, you can be like him. He has done very well, Lynn. You're absolutely right. I thought his story was great. And I was just so pleased that he wanted to share his story with us. System buffering. Okay. Bye, Robin. Sorry. I don't know if it's on my side or where. Keep working towards it. You can do it. Yes, you can do it. Whole food plant-based eating is not that difficult. It's just a lifestyle change. You just have to work at it. Yes, Debs, it will be. I can't wait to see those results. And Seeker, you're working on the vitamin D still with your mushrooms. Isn't that right? Are we still having mushrooms every day? I think that was you. Yes, it gets easier. Oh, Chrissy, that's you. Okay. You're still having the mushrooms every day. Good, good. Can't wait to hear about your vitamin D level. I try to have mushrooms every day on my days that I don't fast. So we have lots of mushrooms. We go with fresh and canned both. So we mix it up. And I've got a refrigerator full of fresh stuff ready for me tomorrow. So we were going to do a cleanse at the clinic. We were going to start today, but the supplies did not come in, so we put it off to next week. That's just something I'm doing to kind of support some of the other members of the clinic that want to do a cleanse. It basically results in, or the end result is something very similar to a 3-day fast, but it's not a true fast because it's a super low calorie drink regimen. It works out to about 400 calories a day. So I'm going to do that with them. So that'll kind of interfere with my regular fast, but it's such a small amount of calories over 3 days that I think I'll get the same benefit of a fast. Let's see. I'm trying the best you can, right? And that's all we can ask, right? You never knew you'd like them as much as, Chrissy, mushrooms are delicious. I love them. Oh, you have some frozen. I've not seen frozen mushrooms. I think that's interesting. I'm sure they're fresher. One of the best ways you can get fresh fruits and vegetables is to get them frozen, and they're very inexpensive that way. It's probably one of the best ways to get a whole food plant-based diet going without spending a lot of money is to have a lot of frozen vegetables and frozen stuff. There's a video out, a new movie that's just come out. It's called Diet Fiction. I mentioned that the other day. I'm going to type it in here. And I watched it over the weekend, and I'm a big fan of these documentary type movies that explore diets, and then they sort of delve into the whole food plant-based culture and how people are changing their lives by doing that. And that's what this movie does. It starts out by examining different kinds of diets and how ineffective they are, and then it moves you into the whole food plant-based world as a lifestyle, and then begins to show you all of these people. And there's a nurse dietitian. Her name is Popper, and she's fantastic. Dr. Ornish makes an appearance. Rip Esselstyn makes an appearance. Dr. Greger, many of you know, makes an appearance, and many others. But a lot of those that are on my, greatest of list of medical people who are advocating for whole food plant-based eating are in this movie. And I think they really did a fantastic job. So I put it right up there with the book Proteinaholic. Speaking of which, the author of Proteinaholic, and I'm not going to call him Garth Brooks again, right? So Garth Davis, thank you very much. Got that right. He makes an appearance too, and so he talks as well. And so anyway, great book. I mean, a great movie, diet fiction. And I recommended it a couple of times today, and I'm still recommending the book Proteinaholic to people. And I keep a copy of the Amazon printout of the title of the book and what it looks like, and I print that off and I give it to people throughout the day that really want to know more. I'm still getting a lot of people that haven't seen me in some time, and they're like, "Wow, you've changed." And I say, "Yeah, I've gone through a big change." And they talk about it, and I say, "Well, look, here's what you want to do. Read this book, and you can get an idea of what I've done." And so that's an easy way for me to get that information to them in a way that they can take it home and they can read it and they can go. I don't know the name of the cleanse, Chrissy. I'm sorry. I just volunteered to participate, and I paid my money for my share of the cleanse. And so when it comes in, we're going to do it. It'll be even easier when you get your new refrigerator. Yes. But what I was getting to is, I believe it was Rip Esselstyn who said that if you look in his freezer, it's just full of frozen fruits and vegetables, because he finds that's the best way for him to stay on top of having plenty of fresh things to eat without having to hit the grocery store 3 times a week to pick up fresh produce. And sometimes that can become a chore too. So, Lynn, you're in the UK. Okay, gotcha. We can't get frozen pineapple here. I had a great fight cutting one up the other day to freeze. Is it possible you can get canned pineapple that's not sweetened? Frozen avocado. Now, I've not seen frozen avocado either. That's interesting. Although I don't go to the whole food places. I don't go to the health food stores and places like that. I just shop at the regular Kroger right down the street. They've got a very good produce department and a pretty good selection of frozen stuff, and so we use that. What do I guess your vitamin D level is going to be after eating these mounds of mushrooms? Yes, I think you will be better than normal. I think you'll be higher than normal. I'm hoping for you, Chrissy, that you're going to be somewhere around 50. I'm hoping your vitamin D level is around 50. You can't afford to buy those books. Well, maybe we need to get you a copy of one of those books. They're all in juice sweetened. Yeah, I thought so. I thought that might be the case. I'm sorry about that. So frozen pineapple, frozen avocados, all kinds of frozen mushrooms. You guys are teaching me about frozen stuff, because mostly when I get frozen, I don't usually get the fruits. I get the vegetables. Okay, you can buy fresh avocados and cut them up and put them in your Ziploc freezer bags and freeze yourself. Yeah, okay, that makes sense. Probably makes good sense to wait for them to properly ripen. You know, we seem to get a lot of avocados this time of year. They look good, but they're not ripe. they're hard. The consistency is very firm, very hard, almost crunchy, and so we have to make sure that they're in good shape. Yeah, I bet Costco does. And the DW was at Costco. And what did she buy for me? Oh, she bought. She went in and she got us some whole wheat flour because we were almost out. And then there was something else that she went in and got for me. What was it? I'll think of it in a minute. Oh, she uses Costco for maple syrup. Maple syrup, for some reason, at the Kroger is very expensive for a very small container. But Costco has a container that's more than twice the size for about $10 or $11. It's the same price as this teeny tiny maple syrup. And I put maple syrup in lots of things. It's one of my sweeteners of choice. So when I make bread, I like to put a little maple syrup in there. Like I talked about my bread recipe the other day. I use a little maple syrup. It's a really good choice. It's a whole food, plant-based whole food, and you really can't go wrong unless you're just trying to cut back on calories for some reason. It's a great sweetener, though. Let the avocados ripen and then freeze them. Yes. Costco's got a lot of good frozen stuff, Bonnie. You're right. I don't even really think about Costco because they're kind of off the beaten path for us. We have a really wonderful Costco. But it's got to be a trip to Costco because it's not sort of on the way to anything that we do on a regular on a regular daily kind of thing. So it's not on my way to work, for example. It's not usually in Tomball. It's down closer to Houston for us. So it's a few miles out of our way. So we don't go by there as regularly. Thank you, Cindy. The recipe is very easy. It's basically 2 to 1. All right. For every 1 cup of water, you use 2 cups of whole wheat flour. Make sure you put don't forget your bread yeast, your quick rising yeast, and a little bit of salt. And then you put your warm water and maple syrup in there and stir it up. And if you're like me and you like to add a little texture to it, that's when I add the chia seeds. And right now I'm going through some flax seeds that we've got in a bag that I wanted to use because it had been opened and I wanted to be sure it didn't go bad. So I started splitting my chia seeds in half with flax seeds. Vegemite or Marmite. I'm kind of ignorant of Vegemite. I thought Vegemite was kind of like peanut butter. Am I wrong about that? Isn't it like peanut butter? And Marmite, I'm totally at a loss on. So you'd have to educate me. Maple syrup aged in bourbon barrels. Well, I'm all for anything that comes out of a bourbon barrel. I'll tell you that right now, Debs. No, I'm getting a big no. Is that the no that Vegemite is like peanut butter? I know it's real popular on the other side of the equator. A yeast spread. That is interesting. Saw it at Costco. Malt-based flavoring. Okay. So we have it's not peanut butter. It is the other kind of like peanut butter that everybody likes here too. And Nutella. We have Nutella, which is like hazelnut, I think. Yeah, I've never tried Vegemite, and I'm not sure I've tried Marmite either. But you guys can teach me something about a different way to enjoy spreads, then I'm all for it. Because I like a little piece of bread once in a while. It's been said. Totally awful. Huh. Okay. So I like almond butter. We keep some almond butter. Almond butter almond butter is a bodybuilding product. If you get a jar of almond butter and you check the ingredients and the ingredient says almonds, you've got the right stuff. And it's hard work because when you first open that almond butter, you've got to get like a butter knife and you've got to get in there and you've got to really stir that stuff up, because the natural oil from the almond, the crushed almond, will kind of work its way to the top and you get this layer, and you've got to stir and you stir and you stir because the almond at the bottom gets drier because of that. And so you've got to really work to stir that all together so you have like a smoother kind of mix, right? But once you do it the first time, and you can spend a good 10 minutes really working on getting that stirred up to where you have a nice consistency, a nice homogeneous kind of consistency. What I've learned, here's the secret though. The secret to almond butter, after you've done that hard work stirring, after you use it and you put the lid back on and you wipe off anything that's come off, turn it upside down. Just turn it upside down. Then everything stays fine. All right, I missed some stuff. Nutella, hazelnut, chocolate. I've had the regular Nutella before. Vegemite is a thick, black Australian food spread made from leftover brewer's yeast extract with various vegetable and spice additives. Well, it seems to be popular. Chrissy, it's so bad. Oh, bless your heart. Okay, well, hey, we all are raised on what we're raised on, right? Homemade almond butter the other day. Lynn, I think you just throw almonds in a processor and just blend the crap out of it, and I think you mush it down. I think you hit one of the settings that totally turns it into paste. Marmite, nutritious black, tasty, savory spread, enjoyable on toasters or even as a cooking ingredient made from spent brewer's yeast, comes in distinctive black jar with a yellow lid. Okay, I'm just going to stay away from Marmite and Vegemite for now. Order your maple syrup from Sugar Brushes in upstate New York or Vermont, so much better. Okay, so the maple syrup that we buy is what's available locally, number one, and it is from Vermont. So, and it comes in this really cool looking, looks like an old-fashioned kind of jug. It looks like an old moonshine jug kind of look to it. Anyway, it's very tasty and we like it. And I'm not Sugar Bushes. I wonder what shipping would add on to that. I bet that would be expensive as opposed to just picking it up locally. So I would have to look at that. That could be interesting though. All right. More good stuff. I hope you guys are having fun tonight. Any other good questions, interesting things? Promite. Good grief. We're really getting somewhere now. I don't know what Promite is. Anybody else? Promite? Every mite. Promite is Australian. Okay. I'm feeling left out. I want to learn how to make a really delicious vegan chili. That's what I would like to do. I would like to make a really delicious vegan chili. Maybe my secret ingredient could be something like Marmite or something. I could go to a chili contest. We have big chili cook-offs out here. It's some of the most unhealthy people you've ever seen in your life will gather at these giant chili cook-offs. Some healthy too, don't get me wrong. You're going to send me some what, Joby? I'm doomed. All right. If you take the time to send me something, I will try it online and I will give you a real review of it. But you can't show my face. I don't have to. I don't want to have to show my identity while I do it. Oh, that was bad. So if you get a chance to watch Diet Fiction, I want to recommend it to you because I think you'll really enjoy it. I think you'll get a lot out of it. Chocolate chili. Yuck. Okay, Joe, do I put it on homemade bread? Can I put it on homemade bread? Chocolate enhances the chili spice. Here's the thing. Real chocolate, cocoa is, from the cocoa bean chocolate, dark chocolate's actually very healthy. We ruin it in the United States because we turn all chocolate into milk chocolate, right? So a Hershey bar is milk chocolate, but they do make a dark chocolate. But a really good dark chocolate has an interesting taste. I like a really dark chocolate. Not sure what I get. Real crunchy, almost a bitter chocolate is actually pretty interesting to the palate to me. Don't spread it thick. Don't do it. We have some cacao. And I used it in a bread recipe at one time, and it was actually pretty tasty. It was a chocolatey kind of bread, which didn't do a whole lot for me, to be honest with you, but it was a different taste. I like trying different things. Don't do it. And Chrissy is warning me away. Okay, guys. What do you say we call it a night? Thanks for jumping in. It's 9:15. I'm going to thank you for jumping in and enjoying my day with me. Oh wait, I got a question. Hold on. Hold the phone. Stop the presses. We've got an all caps question. That means it's important. Wanted to ask about my daughter's diabetes. She is 42, has been diabetic since 15 years old. She's lost over 130 pounds over a 3-year period. She still has to take meds for diabetes plus insulin. Well, Louise, is she a type 1 diabetic? Have to know if she's type 1. Or just ask me about, if you have a question specifically about her diabetes, ask me. Eating a spoonful. Okay, she's a type 2 since 15 years. Okay, I'm really, that's a really strange thing for a 15-year-old to become a type 2 diabetic, especially almost 30 years ago. Was she very, very overweight when she was first diagnosed type 2 diabetes? That would be my next question for you. I got to see this one through, guys. Lynn, you have a great night. Thanks for holding. Everybody's holding. Sugar bush to watch the process. Oh, to visit a sugar bush. I thought Sugar Bush was the name of the company. So that is apparently a maple syrup producing tree, a bush. Wonder if totally genetic, not huge, but some. I'm not convinced that she is absolutely a type 2 diabetic, Louise. I would have to I would have to ask you to ask her doctor if she's ever had a C protein done. And there is a test that can tell you whether a diabetic is indeed a type 1 or type 2. Not C-reactive protein, okay? The C protein I'm talking about is the test for diabetes. C protein diabetes. I'm going to give you the correct C peptide is what I'm looking. Peptides and proteins to doctors mean the same thing, okay? All right, so now not C-reactive protein. That's an inflammatory marker. It's a very nonspecific inflammatory marker, but it's very sensitive. Different issues. What we're looking for is something called a C peptide, and that tells us whether or not a person is type 1 diabetic or not, okay? If they have the a C peptide test, then we can find out if they are type 1. Now, like I've talked about before, some type 1s over time develop some characteristics of type 2 diabetes. If you have type 1 diabetes, you will always need insulin. You will always have to have insulin. But if you are a type 1 diabetic and you become overweight and you eat animal products, you will begin to take on the characteristics of type 2 diabetes as well. So you will become a type 1.5. So your daughter sounds like she's a type 1.5 to me. It sounds like she needs the pills to improve her insulin resistance that she's developed. And one of the ways you'll know that is over the years, if she's required higher and higher doses of insulin, it's because she's taken on the characteristics of a type 2 diabetic. So she's technically type 1.5 under the Dr. Gilmore rules of type 1 and 2 coming together, this great convergence I talk about. So they'll tell you that it's either hereditary, which is probably not true. They'll say that she had a virus and that's what caused her type 1 diabetes, because that's what everybody blames it on in teenagers that develop type 1 diabetes. They say they got a virus and the pancreatic cells that produce insulin were damaged and they're not able to produce insulin anymore. And that's typically not the case. Typically what is the case is they developed an autoimmune response as a result of eating animal proteins, and it caused their body's immune system to mount a reaction or to mount a response against the beta cells and destroyed the beta cells that are responsible for producing insulin in the pancreas, okay? So if your question is what's going on, I think she's a type 1.5. If she loses weight and adopts a whole food plant-based diet, she will probably move away from the type 2 to strictly being type 1. But the good thing is she'll require less insulin, but she will still need insulin if I'm correct. And I'm not going on a lot here. But if you want to know whether she's a type 1 or not, then the correct test is a C peptide test. And you can ask your doctor to run a C peptide, or she can. She's 42. She's a grown-up now. Why can't you eat grapefruit when taking Lipitor? Because grapefruit and Lipitor are both metabolized in the liver through the same enzyme system. So what'll happen is it will cause your Lipitor levels to get too high, and you can actually end up getting sick. So you don't want to do that. And you can read about grapefruit and Lipitor, but it's one of the warnings that we give people that are on any of the statins. Statins and grapefruit. Let's see what Dr. Google says. Grapefruit contains a chemical that interferes with your body's ability to break down or metabolize statins. A level of statins in the blood can increase, raising the possibility of side effects. Yep, nailed it. I got it. So can I eat it while I'm off Lipitor? Absolutely. If you're not on Lipitor, if you're not on a statin, then you may eat grapefruit. Hope that helps. The James Bland Show. James, how are you? You have come right at the end of our discussion. I invite you to watch from the beginning. It was fun today, but we are about to sign off, guys, and I've got to get inside. So you've been off 4 days now. So yes, it's okay for you to. And Deborah's here. Oh, I hate leaving when new people are coming in, but we're about to wrap it up. It's been 4 days now, Vi. Yes, you can start eating grapefruit if you would like. Okay, Deborah. Hi. I wish we could stay, but I've got to get in now because I am coming to the end of the day, and the turmeric is working. Yay! Wonderful, wonderful. Okay, guys. Wonderful talking with you, and let's do it again soon. Tomorrow is Tuesday. Hopefully, I'll have something interesting for you during the day, and hopefully, maybe we can talk tomorrow. And I will see you guys again soon. Love you all. Thanks for letting me share my heart with you tonight, and thank you for sharing all your great comments and entertaining me. Man, everybody's showing up. Now we got Hank. Next time. Love you guys. I'll see you soon. Bye for now.